This is Abia COVID-19 update.
Abia COVID-19 update.
Joining us this morning on the conversation, we have the Honorable Commissioner for Information, Chief John Okiyikalu, to also bring us up to speed on the happenings concerning coronavirus in Abia State. Of course, as we are so concerned about the issues we have there coming from Aba, glad to have you join us this morning, Honorable Commissioner.
Thank you very much, Michael. Good morning, wonderful people of Abia State.
Thank you very much. You did alluded to the situation in Aba, that's the commercial hub of Abia State, as scary. What informed your position?
Thank you, Mike. It was our analysis of the results received so far. The bulk of the community infections happening from around Aba area. We see children being infected. We see families, husband, wife, mother, grandmother, children from some families, and the spread across Aba is alarming. We think that as we continue to test, which we will do, that much more will be discovered around that area. And it is important that we caution our people regarding this new upsurge and to say to them that everyone must take responsibility for his or her own protection. It is no longer the time for you to say, what is the government doing to protect me and my family? You must take responsibility to protect yourself and members of your family. Because what we are seeing in Aba is not good. We are continuing the case search in that area. We need to warn that this is not the time to leave your house in Aba without wearing face mask.
I want to know, we also want to know, what is the rate of infection there in Aba?
If you take, I think that is the best measure for us now. When you collect 26 samples and you have 15 positive, it should alarm.
When you take 15 samples?
No. When you collect 26 samples
26
and 15
samples.
of them return positive results,
Wow.
that should alarm you.
It's very alarming.
Extremely alarming.
Extremely alarming. But the question will still be, what is the government doing? That will still be the question. Unfortunately, so many persons are not following the precautionary measures being put in place and the protocols being put in place by the governor and the health agency. What are you doing to ensure that people take their lives seriously?
Well, what we are doing is exactly what I'm doing now, which is to sensitize our people, inform them adequately that this is the challenge we are having, that they must take personal responsibility for their own protection. And beyond that, we are going to quickly put some measures in place. We are reviewing infections related to our current transport system. We are reviewing infections related to the market, because some of those that tested positive are in our different markets. And it is quite worrisome that people still go to market without wearing face masks. And we will roll out the measures. Right now, as I speak to you, there is a meeting that is ongoing at the residence of the Deputy Governor to review these issues. And as soon as we are out of the meeting, we will inform the good people of Abia State on the way forward. Let me state that there is no option that is not on the table, including a fresh total lockdown, a fresh reinforcement of border closures, massive daily testing of as much as 1,000 and above for the next 2 weeks. We are looking at all the options, and at the end of this meeting, the people of Abia State will be informed on the way forward.
With the rate of infection you did stated this morning on the program, it looks like if care is not taken, Aba will be the epicenter of this disease in the southeastern Nigeria and also, of course, in Nigeria.
If that happens, the reasons are obvious. Our traders were absolutely careless in bringing in people from outside the state to come and buy this and that, particularly during the lockdown. And even right now, a lot of people in Aba do not believe that this disease is real. And so they are making mistakes. They are moving out unprotected. They are causing distress to themselves and their family. Transporters continue to refuse lawful entreaties. Those keke riders are still not using face masks, and they are still carrying more than 3 passengers. Now, these are issues that every individual must look at. When we say lockdown, we don't want to punish you. We are just saying help us to slow down the spread of the virus. This virus can only move from person to person, and the only way you can carry it is if you move. The virus does not move on its own. It has no leg to move. It doesn't even have any hand to infect anybody. But when you move and you are infected, the virus will move with you. Sometimes people are asymptomatic, and even though they are not showing symptoms, they infect others. And those that are infecting might not be asymptomatic. We are even hearing about stories of some that were unable to confirm to be COVID-19 positive, but they died. And after their death, we find some evidence of COVID-19 infection, and that is very, very worrisome. We wish that everyone will submit himself or herself to test. And I want to thank you for listing out the locations where this test can be done. In due course, we will embark on another round of massive testing. Whether that will come with a lockdown for a minimum of 14 days to slow down the disease, I don't know as yet. Whether that will come with total enforcement of restriction on interstate movement, yes, that will happen with whatever measure we are going to take. Because we can't continue to allow people to bring this disease from outside to Aba because they want to buy and sell.
Interesting. Now that the government has released those health facilities, I mean the location of the health facilities where a test can be carried out, is it free?
Absolutely free, from sample collection through to testing or analysis, all the way to medical management of the patients is free. Indeed, I am surprised that some people are refusing to submit to medical management. This morning, I read a report of a medical student. Of course, that happened outside of their state. Within 3 days of infection, both parents were medics. Within 3 days of infections, he lost his life, 21-year-old, and with no underlying health condition. And then the mother is in isolation at an isolation facility. The father is also there, both of them battling for their lives. And the parents actually believe that either of them gave the infection to the young man. So I don't think this is the time for anybody to begin to argue whether COVID-19 is real or fake. The governor of Abia State graciously made public his status when he got the infection. And to the glory of God, he's been nursed back to good health and will soon return to us after observing the mandatory 14 days isolation period. He will soon return back to work from the isolation facility where he's being nursed. So if you look at it, if the governor of Abia State, who has been leading this fight against COVID-19, will get the infection and so declare publicly, why are you ashamed or afraid to go for testing? There is one facility at Aba for you to be able to submit your samples and we will test. 2 others are no more here as listed by you, FMC and Amateur Specialist Hospital. The truth remains that Abia is the highest testing state in the southeast, and that is good. If you understand the epidemiology of this disease, the more you test, the more the likelihood that you will take out problems where there is. But I need to warn that in the coming days, our numbers will keep increasing, not decreasing. Nobody should start talking about flattening of curves. If we all work hard and do the right thing, by September, we can start talking about flattening of curves. But if we don't take responsibility at individual level, by the end of June, we probably would have been talking about more than 5,000 infections in the state. and that is not desirable.
Interesting. As we are trying to educate and also tell people to go for testing, there are things that they should go with probably when they go for testing at the various health facilities carrying out the test.
No, the most you need is your identity card, nothing else.
Just your
If
identity
you
card.
have if you have an identity card, you go with it to verify your name and your address. Otherwise, you don't need any other thing.
Is it compulsory for them to have any of those symptoms being presented, by coronavirus? If you have a coronavirus, if you're a coronavirus
No.
suspect,
No, you see, of course, you've listed the symptoms, the signs. I am aware that many people in Aba have lost sense of taste and smell. That is not a good sign. You should go for an immediate test before this thing progresses to a level you cannot control. Don't sit there at home and say, I am asymptomatic, even if I have it. There's nothing happening to me. I'm not having those symptoms. No. If you suspect something, if you feel something, if you have some contacts that you are worried about, please go immediately and be tested. If you are tested and you come back negative, that is a good reason to keep that status. Make sure that you don't expose yourself again, because it is possible to be negative today and by tomorrow you pick up infection as a result of carelessness and you go down with the virus. Going down with this virus is something that we can all work hard to prevent at our individual level. If you go down with the virus, your family will suffer, you will suffer, people around you will suffer, and then you will spread the disease in addition. Let us take all necessary precautions to protect ourselves and make sure that the virus does not in any form or manner come close to us.
thank you very much, Honorable Commissioner for Information, Chief John Okiyikalu, for joining us this morning on Abia State COVID-19 update.
Thank you, Michael. It is well with us in Abia State. Even this one will pass, but we must do our individual bit to hasten exit from this challenge.
Thank you very much. We take a breather now. When we return, we take your calls, your observation. What do you think about the present situation? And of course, what do you notice in your environs as we're trying to, as much as possible, to ensure that we curtail and, of course, break the chain of transmission of coronavirus in Abia State? It is still Abia State COVID-19 update.
This is Abia COVID-19 update.
Avia COVID-19 update.